Hi everyone, again, my name is Feliciano Ocegueda. I am a water justice research analyst with the Little Village Environmental Justice Organization, also known as LVEJO, and I'm excited to share with you all today an overview of my fellowship project that I did in my time with the National Equity Atlas Fellowship. Next slide. So to start off, I'll share a little bit of information about the organization I represent. So LVEJO is based in Chicago's Little Village neighborhood and has been active in the community coming up on 30 years now. The mission of LVEJO is to organize with our community to accomplish environmental justice in the neighborhood and achieve the self-determination of immigrant, low-income, and working-class families. A lot of this work includes doing organizing, research, and advocacy in the community and in the city as well. And for the specific program that I work with, the Water Justice Program, this means working with other environmental justice and water advocates to push for equitable water policy change on a range of issues. Next slide. And so coming into the fellowship, the issue that I wanted to support, the advocacy issue that I wanted to support with my fellowship project was our ongoing work to get the lead out of Chicago's drinking water. So currently, Chicago has somewhere around 400,000 lead service lines providing drinking water to residents. If you're not familiar with how this piece of infrastructure works, there's a diagram on the slide that outlines how water is distributed from water mains into people's households using lead service lines. So currently, with over 400,000 lead service lines, this poses a major public health risk to residents in the city as um, there there exists a risk of contamination of drinking water with lead. There's currently no safe level of lead in drinking water, and even small amounts of lead exposure can lead to serious health risks for humans, especially for young children. Now, wait, if you go back to the previous slide, the city has began replacing lead service lines, and in the past 3 years has replaced somewhere around 4,500 lead service lines. But this remains a major issue, especially one with racial inequities, as recent research indicates that Black and Hispanic children both are both at higher risk of childhood lead exposure through drinking water and at a lower risk of having their water tested. Next slide. Now, when thinking about how I wanted to structure my fellowship project and creating a data tool to support this research or this work, um, here's a diagram kind of listing out some of the different stakeholders that I wanted to consider, centering the needs of water advocates in the city, while also considering accessibility for Chicago residents and Chicago policymakers, and as well as the media in terms of sharing information at large. Next slide. So my key audience in developing my data tool for this project was water advocates, and my ultimate goal was to create a data tool that can support their advocacy work to remove lead service lines and protect water customers from unsafe drinking water. The major question that guided my research was very basic. It was where are lead service lines in the city located? And then secondary questions were what are the public health impacts of the current state of lead in drinking water, and what communities need additional water testing and filter distribution services. The data that I used in creating a data tool included several different data sets, and but was mainly focused in the city of Chicago on two geographic levels, the community area level and the ward level, and included public data from the U.S. Census Bureau's American Community Survey and the Chicago Department of Public Health's Chicago Health Atlas. Major data points that informed my data tool were also gathered through Freedom of Information Act requests submitted to the Department of Water Management here in Chicago, and they included the city's service line inventory and lead service line replacement program data. At the bottom, you can see a screenshot of what the service line inventory looks like. Residents can enter in their address and get information about whether they're likely to have a lead service line at their household, but currently this tool does not provide an overview of the city as a whole. Next slide. And so for my project, I use the Tableau story format to kind of provide different views and different contexts for what lead in drinking water looks like in the city, what this issue looks like, and how to support how this data can inform water advocates' work. In a Tableau story, you have several different visualizations with headers. Here you can see the headers outlined in purple at the top, and the users can tap through each header, looking at different maps, scatter plots, and other visualizations. Here in the default view of my Tableau story, you see a map that visualizes where lead service lines are across the city of Chicago by community area. And at the bottom, you have outlined in red my source. I also wanted to make sure that since this was data that I accessed through a FOIA request, that users can also, click on a link and reach my FOIA request and see the raw data that I used in putting together this visualization. Next slide. Here we have another screenshot from my data tool. In this one, this is a different header. So this is a few steps ahead in the narrative that I provided on the Tableau story around lead in Chicago's drinking water. And in this visualization, we have a scatter plot that shows where how communities with larger populations of color experience higher rates of childhood lead poisoning. We have some more interactivity here. In the previous map, you could hover over and have a pop-up provide some numbers. But here you're able to highlight specific communities and also see different data points on lead poisoning and population of color. Next slide. Now, in developing this Tableau story, utilizing different data on lead service lines, lead poisoning, as well as lead service line replacement, I wanted to combine a narrative structure with interactivity for users, which is why I settled on Tableau Story as my format. In my Tableau Story provides a progression of visualizations where you can drill down on what communities are affected most by this issue. And as well, if you're coming from, if you represent another community-based organization or a resident of a different community across the city, you're able to, look at specific numbers for your community area or your ward and get information on what this issue looks like in your area. Again, the default view that I provided was covered the data set that I accessed through my FOIA request. I wanted to make sure that this new data that previously was not public was up front and center for water advocates to access. As well with a Tableau story, there's also always the possibility of quick future updates with new data as as lead service line replacements continue and as this issue changes. Next slide. There is some ongoing work that I am doing both for my tool and also to share in the future and how it'll be utilized. There's still some more feedback that I would like to gather in developing this Tableau story, especially in talking with other water advocates. The ultimate goal, however, is to publish on LVEJO's website and be able to share with not just with other water advocates, but with residents of our own community. And in order to do so, future work needs to also be done to provide Spanish translation to assure language accessibility, as Little Village has a high number of Spanish-only speakers. Once those first 2 points are done, the goal is to promote this data tool through our newsletter, social media, and LVEJO events. Some final reflections here on what it was like to be in the fellowship and also develop this data tool. I definitely learned the do's and don'ts of submitting FOIA requests. This was the first time I have submitted a FOIA request, and I had to do a few different requests to make sure I was getting the specific data that I wanted. I also gained an appreciation for working with very large data sets, as the city's lead service line inventory covers somewhere around 500,000 service uh, households that are provided service. And ultimately, because I wanted to center the needs of my key audience, that means that this tool isn't complete just yet, but I'm hopeful that it will have a great impact once it is. And also just wanted to send a message of appreciation for the feedback and insight that the National Equity Atlas staff and other fellows provided me along the way in developing this tool. And there's an image of me looking at some of the other great work that other fellows did. And thank you all. That covers my presentation. I have here my contact information. If you'd like to learn more about the work that I did as a fellow,